you have an interest in therapy and you have capacity and desire, therapy is amazing. I go to my own therapy. It is a really profound experience and people deserve the space. And I think most people are surprised at how much they can really get from the experience. So I would say if you have a desire to go to therapy, go to therapy. It's really amazing. My journey sort of started a long time ago, right? I went to undergraduate and got a behavioral sciences degree. From there, I sort of worked in the field, just working with a variety of different populations. And then I went to grad school and got my master's degree in social work. Once you graduate with your master's degree, you sit for a licensing exam. Which is really exciting when you pass your licensing exam. At that point, you are what we consider in my field in social work is a licensed master's level social worker. From there, you don't have to, but you can pursue a clinical licensure, which is a licensure that I have. When you're pursuing that license, you have what we call a clinical supervisor, which is just basically somebody who's overseeing your practicing, making sure that you're kind of having some extra guidance in the process. You have to obtain 3,000 hours of clinical experience during that time period of clinical supervision, and you have to be meeting with your clinical supervisor throughout that process, obviously. I think, if I recall right, you don't have more than you can't finish within 2 years. It takes most people a lot longer than 2 years, but 2 years is the minimum amount of time you have to have from grad school to sitting for the next exam. So you have your exam after grad school, and then after you complete all the necessary hours for your clinical license, then you sit for another exam. And then once you pass that exam, then you have the license. That's what we call a clinical license. So in my field, that's an LSCSW. My style is really engaged. I work really hard with my client. I recognize that it takes so much courage to kind of step into the therapeutic space that people are really worth showing up for once they're there. And my style just sort of strives to honor and value the whole person so people can really show up in their wholeness. So with that, I sort of tailor each therapy to the individual needs of the client. So sort of eclectic in my approach. I think most of us all are, being that we pull on a lot of different treatment modalities and therapeutic orientations to really sort of wrap around the unique needs and strengths of each client to really optimize their sort of transformational journey. I think also for me, I'm a huge neuroscience nerd. I find it just infinitely interesting. I can't stop just kind of digging into it. And so that science is really wrapped up always in my work when I'm talking with people. I really talk to them about what's going on in their brain and what's sort of firing so they can sort of be empowered in that space. Especially when it comes to trauma and of course, intergenerational trauma. There's just a lot of body work and some somatic work, kind of working with the nervous system. I don't think we really recognize how prevalent trauma is, nor how profound its impact really is. So really kind of wrapping the science around that. I think another thing that's really important about my style is that I work with a person to really deconstruct, name, and externalize the systems of privilege and oppression that are impacting their lives. So there's sort of a movement to decolonize mental health, right, which is really big and vast and huge and exciting and way beyond the scope of what we're talking about here. But one small way that I can sort of integrate that into the therapeutic space between me and another person is just to really sort of name these things that are happening. Again, this obviously doesn't eradicate the impacts of the trauma or the oppression that comes with that, right? It just empowers them to sort of hold it a little differently. It's a space where people come to enhance their life for a variety of different reasons due to external or external variables or causes, right? I think that's really simplistic. I think the bigger answer, again, has to do with the uniqueness of the client, and really giving space to allow them to show up in their wholeness, right? Which means that even when it comes to what the purpose of therapy is, as a therapist, me taking a step back, allowing them to take a step forward and define that for themselves. So some people are coming in to heal, some want to do some transforming, some are wanting to grieve and be seen in that grief. Some are coming in because they want to maybe just be more organized, or they're having relationship conflicts, or maybe some combination of all these things, right? But I think it's important for me to give space to the client to decide how they would define a successful therapy, and not for me to impose those expectations onto them. So I guess my role in that is sort of to create a container, right, that's held together with my clinical skills, that is safe for the client to be able to explore the intricacies of their own goals. So I'm sort of here assisting them in navigating this process while not hijacking their experience, right? They are truly the experts on their lives. I have clinical skills to enhance this exploration with, and they might not just know what path they want to take yet. So I'm just here to kind of help hold that container. I sort of see it like I'm here to just open up doors and see, right? And it's the client's space to say whether that door has any meaning to them or not, and whether or not they want to walk through it. But I'm not here to sort of force them through. I want to first name that that is such a courageous step. And so I think that we don't often name how courageous that first step can be. So I really hope that people can honor that when they take that step, right, and hold grace for themselves in that process. And I think my biggest piece of advice would be to just trust yourself. If you step into a therapeutic space with a therapist and it doesn't feel right, and it doesn't feel like a good match, to be able to just trust yourself to seek something else out. There are a lot of resources available to sort of do some research on therapists. Obviously, a lot of therapists have websites. Psychology Today is sort of a platform where there's a lot of therapists on, and you can kind of do some research around who they work with typically, of their therapeutic orientation, their value systems. So it's okay to definitely do the research. You deserve to be able to have therapy that is helpful for you if you're showing up to the space. So really, I would say, just to circle back on that, just really trust yourself in the process to know whether it's a good fit for you or not. I do believe that the biggest challenge is finding the right fit for a therapist, and that process can kind of be disenchanting sometimes, and can feel really emotionally laborious, which makes sense. So I think that the good news about that is once you find the fit, in my experience, the work is immense and big and powerful and connected. But I do think that they're finding the right fit can be a struggle sometimes. Most people do access mental health services through who are obtaining services in a private practice through insurance. That's a big chunk of the people who can access the services, which is great if you have insurance, right? Of course, not everybody in this area is able to have access to insurance or insurance that supports mental health. So there's a lot of us who have either a sliding scale or who have a certain reserved spots on their caseload for pro bono work or for free services, sort of in an effort to continue to prioritize and wrap around more marginalized identities who may not have access to the services. So every therapist is a little bit different, of course, when we kind of step into our first session. typically there's a lot of information gathering sort of happening in that space. Also the potential that there's a lot of paperwork sort of being filled out. I have an online portal, right? So my paperwork is filled out before people come into their first session. And for me, that works really well because I really want to spend my first session sort of putting a frame around what really brought the client into session, what they're hoping to get out of therapy, and really helping them demystify the process of therapy, right? So they can kind of know what to expect moving forward. So mostly for me, our first sessions are kind of getting to know a little bit more about what the journey is going to look like that we're kind of stepping into together. So if a client has boundaries on things they don't want to discuss, they don't have to discuss them. Period. No qualifiers, no modifiers to that statement, right? Just period. That's just the way it is. You as a client should always be in the driver's seat. Again, this is about your journey. And so nobody, including the therapist, should be hijacking or forcing anything. Of course, the more transparent we can be, the deeper the work can go. And also timing matters. And so if people aren't ready, they just aren't ready. And that's more than okay. The safety is the most important thing. I also think that it's really important to name that there are some trauma approaches in which telling the explicit narrative of events is not really an important part of the therapy. Because of the way that trauma is stored and the way that memory is sort of coded during a traumatic event, we can do a lot of working with the trauma without necessarily having to take a deep dive into exploring the narrative of events that happened or telling the narrative of events what happened. But ultimately, the most important thing is to name is that this is your journey to be honored, not hijacked, right? You're allowed to have boundaries everywhere in your life, especially in therapy too. We don't always recognize how, when we bring privilege into a space, we can create a lack of perceived safety, right? So I don't think there's necessarily one specific way to work with marginalized folks. I think that the way that I sort of conceptualize it is, again, this theme that I really strive to honor the whole person, right? To really give space for them to completely show up. And in that, what that means is I have a responsibility to do research and inform myself about the experience of marginalized identities. Now I say that carefully, right? Because that can quickly be wrapped into like, I know your experience, but I don't know their experience, right? So there's still like a very humble stance that comes with that. But it is my responsibility for a client to not have to come into a space and educate me on the things that I should know about when it comes to their identity. I care about my clients in a really real way. So I want to assist them in being as safe as possible. So obviously we want to make sure that we're using good clinical skills to assess safety and make sure that we're helping our clients stay as safe as possible. And of course we have ethical expectations around that too. That being said, I will say that one of the things that I have seen that is one of the biggest struggles for people that really brings them into a therapeutic space is that there's this kind of cultural expectation around how pain is accepted, being that we sort of want people, well, we can hold people's pain with them as long as they kind of put it in like a pretty little box with a pretty little bow on top, and it's able to be held that way, right? And the truth is, pain and healing can be really messy, and it doesn't really fit in a pretty little box, nor with a pretty little bow, right? My clients talk about how we don't mess with bows in our therapy, right? Because the truth is, we want culturally for people to kind of go through the pain and rise out of the ash, right? Like this beautiful phoenix with beautiful wings, with colors that are super vibrant, right? And that happens sometimes, and it is in fact like really beautiful when it happens. But the truth is, the majority of the time, we're kind of crawling out of the ash, right? Barely gasping for breath with wings whose hue is barely visible underneath the soot and the ash. And that too is healing, right? And that too is a part of the journey. And so a lot of people come into a therapeutic space because they need a space where their experience can be just messy, right? Doesn't have any requirement to be put in a pretty little box with a pretty little bow. And so I think we also have an obligation as therapists to be sure that we are providing that space for them in a context that's safe, of course, but that we aren't requiring them to sort of fragment off parts of their experience in order to be able to be seen in the therapeutic space.